Thank you, Chairman. How you doing? My name is Whitney Fuchs, and I'm the CEO of InCommunity, and I'm also a board member of SPAD. SPAD is the provider association that represents providers who support people with IDD throughout Georgia. My comments today reflect SPAD's position as well as the position of InCommunity. A little history. I've been doing this since 1984. My whole career has been working with people with intellectual and developmental disabilities. Matter of fact, I started my career as a life skills trainer, which is in other parlance, a direct support professional. So I've worked my way all the way up from the direct support position into the position of CEO of an organization that serves 1,500 people a year here in Atlanta. We very much appreciate Senator Harrell's support in getting this bill through, especially the Senate and the Senate committees, Health and Human Services Committee, and the entire Senate for voting for this. In my career, I've learned a couple of things, just a couple. The first is that all change is incremental. We'd love to see sweeping changes to the impact of salaries of our direct support professionals. We realize there are a lot of priorities, and that the priority for serving people with intellectual and developmental disabilities is oftentimes lower on the totem pole. We appreciate the opportunity for raising it up and identifying that this is a step. It's an incremental step towards creating some wage improvement for our direct support professionals. At InCommunity, we have about 565 employees if we were fully staffed. We have 166 openings. 157 of those openings are direct support professionals. We pay $12 an hour. Can't find anybody. Our overtime is currently at 26% of our payroll. So that gives you an idea from the business perspective of what this does to organizations. When we get requests for people who want services, the first thing that we look at, are they going to require exceptional staffing? If they require one-on-one staffing, the answer is usually we don't have the capacity to serve them because we cannot find the staff to give them the supports that they need. This means the people in our care, people needing care, the people who have the most intensive needs are the ones that are not going to be served. This reluctance that we experience, because I tell people we need to fill these openings because filling the openings at the group homes increases our census, helps our bottom line. The fact of the matter is if we can't serve them adequately, we can't serve them with a good quality, we don't need to be doing it. The negative consequence about all this is that when we come time to finally address the waiting list here in Georgia, if we don't have the resources, the staff to be able to deliver that, we're still going to have a waiting list. It's just going to be a different one, as Ryan said. Senate Bill 610 makes a significant step forward. It doesn't answer the question about how we come to you over the years of hat in hand asking for a 5% rate increase. Can we please have this? We get it approximately every 8 to 10 years. Can we please have this? But it does give some evidence of where we should be. It's an incremental step forward. That step forward is important to take, and we appreciate your support of this bill. Thank you for your time today.